Who does capitalist health care harm? Low-income and middle-class families are often defined as homeless individuals, high school students, and the working class. High insurance premiums that is not in their budget or affordable ends up being pushed to the side as a priority, as food and electricity is essential to live. So most families opt to go uninsured and feel that the tax penalty is a better option rather than carrying unaffordable health insurance with high copays and high deductibles. The elderly are also harmed. They often have trouble paying for their medical bills and their health care in general. Um, so they are usually left untreated, and the elderly have such little help with insurance from the government programs such as Medicare. Recent college graduates or students who are still in school are also being harmed. They either are living paycheck to paycheck or graduated from college with a large loan to pay off and have not established themselves professionally, which in turn causes low job security and little to no healthcare benefits. So, for an example, if a student or a recent college graduate was to have gotten hurt and uh, it was their fault, so there's no one else to have insurance coverage. Um, the treatment would most likely cost, it could range up to 20 grand, and you have no way to pay that back. But the treatment was necessary for their health and for their life. So it's pretty crazy to me, and um, it's just crazy to me that the bills are so high and that there's price fixing going on, and it's no wonder why we have we have such high bankruptcy rates in America, or mental illnesses that are left untreated. Possible solutions to price fixing. I would say, well, obviously, government regulations and switching to socialized healthcare. Various companies throughout the pharmaceutical and healthcare industries set an agreed upon price that is extremely profitable for them with no regard to the consumer. The government needs to set and enforce regulations to protect the working class citizens and millions of other Americans who cannot play this game with the pharmaceutical and insurance companies anymore. Socialist healthcare spreads the cost and responsibility to every taxpayer, and everyone is treated equal and never denied healthcare, prescriptions, or medical services because of their inability to pay, resulting in no longer running the risk of bankruptcy or unpaid doctor bills, which could rise the prices of hospital stays to try to make up for the other bills that were not paid. And yeah, I mean, all these health related issues would be able to be addressed by every citizen because they would not be turned down. Um, Possible regulations that could be put in place is that the government could audit the manufacturer and healthcare providers' markup on various supplies and services to keep it at a fair and reasonable price, as opposed to the current situation, which has caused life saving medication to increase 1,300% in price overnight. Now, this is somewhat of a newer topic, and this is why I chose for our group, and Ashley chose as well, this socialist healthcare, because there is uh, well, how do I explain it? There's corporate buyouts, and copyrights are why they're able to increase these prices so drastically from $13.50 a pill to $750 a pill overnight. This was bought out by a company named Turing Pharmaceuticals, and it's owned and operated by Martin Shkreli. The medication is called Diaprim, which is an essential life-saving drug. This medication not only treated pregnant women with autoimmune disorders, but AIDS patients as well. And it's just crazy to me because another scary fact, um, in October of 2013, doxycycline, an antibiotic, jumped from $20 a bottle to over $1,800 a bottle by April of 2014. So that's in the span of 6 months. It's got to be less or give or take a little bit. And it just jumped from $20 for an antibiotic up to $1,849. It's just crazy. So that kind of brings me into capitalist healthcare and socialist healthcare, the differences. So capitalist healthcare has a high cost, often leaves proper care out of reach for many people. Disease becomes profitable, and being healthy costs companies money. Unnecessary procedures and prescriptions are often pushed on patients for monetary gains for doctors, the pharmaceutical business, and insurance companies. People with little to no coverage are often denied proper care to avoid unpaid bills. Some have even been forced to choose between their health, their home, their life savings, and other necessary assets to live a life. Because of their health, people have gone bankrupt and went from living in large, gorgeous houses to, small homes, which is all because of the healthcare industry and the regulations that aren't out there. So having a socialist healthcare system can cause stagnation in procedural and technological development, as it is a less competitive environment. But yeah, compared to capitalist healthcare, where, for example, as we spoke earlier, the medication increase, the companies are battling with each other and seeing how much and how far they can push. So, it's been shown at times to lead to poor healthcare services due to lack of incentive on the provider's part. But, there's always ethics involved in any sort of issue. So I guess moving on, this is a graph that shows how money controls capitalist healthcare. The graph is showing how lobbyists for the pharmaceutical and insurance companies continue to fight to keep healthcare private and profitable, which in turn grants them enormous profits ranging up to $250 million. So, an example, I would say, okay, if you look at the blue bar, one of the blue bars that's marked air transport, it's a little bit below $1 million. Now, all the way to the left, it's over $50 million. And that's how much money is in the healthcare and insurance and pharmaceutical companies. So that that just blows my mind. It's crazy, and it really is a large issue, and it is coming up in the next presidential election on healthcare. I know Obama tried to do the Obamacare, but that hasn't really worked out well, and ended up getting more money for the government by taxing people who don't carry health insurance because they can't afford it. So Moving on, this is a book called The Cure: How Capitalism Can Save American Healthcare. And it's written by Dr. David Gratzer. And it pretty much is, in a nutshell, capitalist healthcare is profitable, and socialist healthcare um, allows for economic growth in a free market society and pushes technologic innovations through competitive growth and environments.